And it's that progress on the vaccine rollout which is leading many businesses and MPs on the Tory backbenches to call for a wider opening of society. Sky's Helen-Ann Smith's been looking at the data, informing the government.
It's the million-dollar question: when and how will life return to normal? The government's being a little more careful about committing to hard dates than it has been in the past. So what do we know? Well, the Prime Minister will announce more in his roadmap on Monday. That's also the day that Welsh and Scottish schools will start a phased return. We now know that care home visiting will be extended from the 8th of March, and that could also be the day that English schools start going back. Beyond that, it might logically follow that rules on socialising, retail and hospitality might follow in the coming months, but we just don't know yet. The new government mantra is data, not dates, and the data may still advise caution. This is case rates from the Office for National Statistics survey. The current rate of decline is striking. Look at the steepness of that line. But when we compare it to where we were in June when the schools last reopened, the rates are still quite high. Notice too how those numbers did start to climb back up once the autumn term got underway. Now, case rates are an element that will guide decision-making. Another key thing will be vaccinations. The programme's been rapidly accelerated and it's expected to continue to do so. Given care home visiting will be one of the first steps in a reopening plan, this number will be likely very important. All English care home residents have been offered a vaccine and nearly 95% have received their first dose. But it's a different story when it comes to care home staff. Despite being a priority group, less than 70% of English care home staff have had their first vaccine, and there's huge regional disparity. London there, just at over 50%. There's a concern that vaccine hesitancy, particularly among some ethnic minority groups, may partly explain this variation. Now, Matt Hancock has previously indicated that hospitalisation rates will also be a guiding factor. So how's that going? Well, this shows the number of patients in hospitals, and it's falling again, you can see here. But just look at this line that cuts across the middle. This shows that as of the most recent data we have, there are more people currently in hospital than there were at the peak of the crisis all the way back in April. Now, this all amounts to a tricky balancing act for the government. Expect any roadmap to be caveated with this. A change in data will mean a change in plans.